and how we serve our communities. In Africa, where the demand for skilled health professionals far outpaces supply, and where access to quality education remains uneven, AI offers us a rare opportunity to leapfrog traditional barriers and build a future that is smarter, more inclusive, and deeply responsive to our continent's unique needs. But that future will not arrive by accident. It must be built deliberately, collaboratively, and urgently. So what are the key actions government and institutions need to take today to prepare for that future? One is to develop national AI strategic rooted in health and education. We must craft and implement national AI strategic that explicitly prioritize tertiary education and healthcare. These strategies should include A, align with broader digital transformations goals. 2, that is B, include clear roadmaps for AI integration in medical curricula. C, to promote ethical, inclusive, and culturally grounded AI development. 2, government needs to invest in infrastructure and connectivity. AI cannot thrive where there is no power, where there is no internet and no access. Government must A, to expand broadband access to rural and underserved regions. B, to equip tertiary institutions with the hardware and cloud-based platform needed for AI-powered learning. C, to support simulation center and digital lab to enable hands-on AI training. The number 3 point is to build human capacity, faculty and students alike. We must invest in people. As much as we invest in technology, this means to train educators to use and teach AI tools confidently, to embedding AI literacy into health curriculum from nursing to public health, to create scholarship and fellowship for AI research in African context. Number 4 is to establish ethical and regulatory framework. AI in healthcare education must be governed by trust. Government should ensure to enact policies that protect students and patient data, to ensure AI systems are transparent, explainable, and free from bias, and to promote responsible innovations through national ethics boards and cross-sectoral oversight. Number 5, ensure equity and inclusion. Finally, we must ensure that AI does not deepen divides. That means designing AI tools in local languages, prioritizing gender equity in AI education and leadership, and making AI accessible to students in remote and marginalized communities. But the question before us is clear. What must we do today to prepare our institutions, our educators, and our students for the AI-powered future of healthcare educations? Let me close by acknowledging the progress we have made in Nigeria. The National Center for Artificial Intelligence and Robotic under the NITDA, which is National Information Technology Development Agency, is a flagship initiative driven AI research and capacity building. The Artificial Intelligence Research Scheme is funding local innovations, including healthcare-related AI projects. The AI policy draft developed by the Public and Private Development Center, APDC, published in January 2025, outlines strategic recommendations for AI development in education and healthcare. Platforms like 24/7 Medics are already using AI to connect patients with doctors, demonstrating how AI can expand access to care even in remote areas. These are not just projects, they are signals that Nigeria is ready and have started the journey. And this webinar series by Anadash and People to People is a reminder that we need to continue this journey. In closing, the future of AI in tertiary healthcare education is not a distant dream. It is a decision we make today, a decision to lead, to invest, and to believe in the power of African ingenuity. Let us act boldly, let us act together, and let us prepare our institution not just for the future, but for a future that is African, intelligent, and just. Thank you.
Okay. Thank you so much, Honorable Fatata. We really appreciate, especially the last sentence, the future that is African, intelligent, and just. I'm going to hand over to Dr. Mehari.
Thank you. So thank you very much, participants, moderators, Dr. Egwe. This has been a fantastic dialogue discussion. That's exactly what Africa needs at this cross junction of technology. And Africa stands today at the intersection of possibilities and purpose. Artificial intelligence is not simply a tool of technology. It is a bridge of imagination connecting our universities to one another, our hospitals to our village, and our continent to its own untapped potential. If we use AI wisely, as it has been suggested by everyone, it can help us speak a common language in healthcare and education, a language built not on one code alone, but on compassion, equity, and shared standards of excellence. But AI will not build Africa. Africans will. What it can do is amplify our unity, accelerate one learning, and remind us that partnership across nations, disciplines, and generations is our greatest strength. Let us therefore move from one pilot to policies, from rhetoric to results, and from fragmentation to one continental vision, where an Ethiopian student, a Nigerian clinician, Rwandan innovator can all stand on the same platform of opportunity. The future will not wait for us. But if we work together with integrity and foresight, the future will be written by us. So I think that's exactly what Anandach and P2P are working hard to bring all this generation of AI African scientists, teachers, clinicians, and so that they can help us shape the AI system that would respect our value and culture. So this is, we will need your reflection how we, as we plan to move this, not only just one time, but it would be maybe we have been discussing with Dr. Ebe, whether it's like every month, 2 months, your reflection on this will help us to shape how we need to navigate. But I think this is a lot of the time as Africans, we are always like behind the curve. But this will help us to be in front of the curve. And so it's thank you so much for the great input and participation.
Okay, thank you so much, Dr. Mahari. Thank you. We at ANADAC are very delighted to work with P2P. We're very grateful for Honorable Fatoba, to Professor Angela Briggs for taking time to join us. We are really grateful to the amazing moderators, amazing speakers. You have generated more questions than you've answered, which is always good when you want to do a series. And we really are very grateful for the participants who have joined. Like Dr. Mahari said, probably the next one will be December 17th. But if there are any topics that you think we should cover, any people that you think we should invite, and it doesn't just have to be in Africa, but anybody that has things that may be useful as Africa thinks about this, please, please, please let us have suggestions or potential speakers. And we at ANADAC remain as usual, ready to work with any institutions as you think about AI and AI strategy. I agree with both Dr. Angela, Professor Fatoba, and a lot of the panelists, and Dr. Mehari. The future is now. And it is what we do now that will shape the future of AI in healthcare for our continent. But thank you so much, everybody, and thank you for joining us. We really appreciate it. Thank you.
Okay.
Bye, everybody. Thank you.
Thank you.
Thank you. Thank you.